We're going to talk about eating disorders today, and specifically, we're thrilled to have Anne Cavaliere with us, who is also at the starting point, a therapist who works specifically with individuals with eating disorders. There was something in her bio that I just want some explanation for. So as a way of introduction, I think what I'm going to do is introduce Anne. And Anne, what does disordered relationship with food and eating mean?
Okay. So I think it's helpful to start by thinking about what an ordered or normal relationship with food and eating is before we get to disordered. So if you think about, we all have a relationship with food and eating because it's something that's in our life every day and we have to deal with it. So a normal relationship with food is one that is has a sense of what a kind of a balanced, nutritious food, foods are, and how you have a balanced intake of food and how you enjoy food. So it's, we need to eat to live, but we're also meant to enjoy eating. So with someone that has a normal relationship with food, they look forward to eating. It's not something that's stressful. So someone that has a disordered relationship with food has a lot of stress, has fear. There might be fear of eating, fear around certain foods, an overly anxious attitude towards calories and fat and how their body looks and what the number on the scale says. They might be on and off the scale any number of times in a day. And they also are using food and eating in a way that it's not intended. And what I mean by that is that they might look to food when they are dealing with something emotional. So if they're feeling sad or angry or lonely, they might tend to go to the refrigerator and, be eating, and the eating gets out of control. But they have some sense because of the brain chemistry, which, that's a whole other thing to get into. But when we eat certain kinds of food, the brain chemistry is affected and it gives us a feeling of calm. So some people are actually using food as a drug to calm themselves. People that restrict their food intake, they might be doing that out of a sense of seeking control. They might feel that they're lacking control in certain areas of their lives. And this particularly attains to teenagers and adolescents that who don't have that much control over their day-to-day lives. They have to live by their parents' rules, but they can control what they eat and don't eat. So that might become a point of concern. So a disordered relationship with food can look a lot of different ways depending on what is happening individually with that person. There are, there's a number of different types of eating disorders.
You want to jump in there, Anne, and start talking about it, and maybe right before we go there, can you I was shocked when we were preparing for this, and I read that anorexia has the highest mortality rate of all mental disorder.
Yes.
I was so shocked by that.
Yeah. Yes. That sadly has remained a fact for many years, and it's a combination of the results of someone with anorexia who has severe anorexia takes a devastating toll on the body. It affects the heart, the muscles, the lungs. I mean, it really can take a devastating toll. And anorexia is particularly challenging to work with and tends to can stay throughout a person's lifetime. I mean, you know, certainly there are people that get some level of recovery, but it's the eating disorder that has a tendency to be with someone, and so it can have, you know, long-term effects. And the other aspect, sadly, part of that number is due to suicide, because there are a number of people with anorexia that unfortunately, you know, resort to suicide. And that also brings up the idea that I don't think I've ever worked with anyone with an eating disorder who only had an eating disorder. You know, they usually have some other mental health diagnosis, whether it's, you know, depression and anxiety being the two most common, oftentimes both of them, but, you know, any kind of mood disorders and other types of diagnoses, you know, contribute. So it's very complex. Anorexia is, you know, a very complex disorder to treat and to live with. It can be devastating, not only to the person, but to the family also.
It must be horrible for family members to watch.
Yes, because they really are in so many ways powerless, and they need a lot of support and help. So if someone with anorexia ends up in an inpatient facility, it starts there, and they, you know, they get a lot of family support. They do family therapy, and that continues through all phases of the treatment that's necessary.
And what about bulimia? Is that also the case?
So bulimia, no, you know, there definitely is some mortality with bulimia, but it's not as high as with anorexia.
Okay.
The risks with bulimia is so with bulimia, I'll just describe the cycle of bulimia is, so the person is eating a really large amount of food in a relatively, you know, short period of time. I mean, it can go on for a long time, but there's a sense of urgency. They'll eat very quickly, but then they must get rid of it in some way. So these are called compensatory techniques that they use. So the most common one is purging by vomiting, which takes a tremendous toll on the body. And it can, you know, ultimately it can lead to a heart attack or a stroke because the electrolytes become imbalanced. So people are eating these huge amount of food, but they're not keeping it. So, you know, in one sense, they're really, you know, starving. And but there's other ways that people that are bulimic can sort of get rid of the calories that they eat. They can over-exercise. So, and that's could be one of the signs that maybe someone that you're living with or that you know has an eating disorder, that they'll eat something that they think that they weren't supposed to, or they've just had a binge that you might be unaware of, but they have to go exercise right then. And it might be, you know, an inopportune time, or, you know, late at night, but they have to go out for a run, or they have to go to the gym. So exercise is another way of getting rid of calories. Laxatives. Some people take unbelievable amounts of laxatives in one sitting. Some people use diuretics, water pills. They think that, you know, getting rid of the water will bring the number down on the scale. So that makes them feel better. Some people even misuse their, they might be diabetic and even misuse their insulin. So other people they might take stimulant medications. They might abuse, if they have ADHD, they might abuse medication for that. So stimulant drugs they decrease the appetite. And so they like that feeling of not having an appetite. So bulimia can lead to, so if someone's had a bad purging episode and you see them the next day, they might look swollen in in their glands here, their salivary glands become very swollen from that activity. Their eyes will be bloodshot because it's if you think about, you know, we've
It's
all
violent.
grown up at some point. Yes, it's a very violent, sort of jarring thing to happen to the body. So it leaves those kinds of after effects for the next day or so. They could also get tears in the esophagus. They can also, another common symptom is the enamel on the teeth wears off because of all the gastric acid that they're producing in vomiting. So they have a lot of dental issues. So those are all things that are happening, you know, as they're in this process, and then eventually they can have the very serious consequence of having a heart attack or stroke due to electrolyte imbalance. And you know, I don't know whoever knows Karen Carpenter from the Carpenters. She famously had an eating disorder and ended up dying of a heart attack in her 30s, I think, you know, as a result. But there's a number of people that there's gymnasts, ballerinas, models especially. So you think of people that are in the public eye and people that are performing and are supposed to look a certain way, and might be told by their coaches or their teachers, you know, you need to lose some weight. You're too, you know, the one gymnast that died when she was 22, she was told by a coach that she was too fat. She was already a gymnast who had won many competitions and was just fine, but a coach said that to her, you know. So there's, you know, there's that aspect of it, you know, that brings in the whole body image issue, which is an issue for everyone, whether it's anorexia, bulimia, binge eating disorder, compulsive overeating, the body image distortion and the difficulties with that are a big, big contributor to what drives people to either starve themselves, and some people, you know, go the bulimic route and overeat and then purge. So it's very devastating, and it's very it's the type of client that when you have a client with an eating disorder, you really need a team. You need to have the person has to have a physician, they need to have a nutritionist, and they need to have a psychiatrist in addition to the therapist, because particularly with anorexia, it takes that many people to support and manage the medical component. You know, as therapists deal with the, you know, the emotional aspect of things, but you really need the medical component managed by a physician.
And how did you start treating eating disorders? I mean, was it something that you had decided you always wanted to do, or?
No, no, it wasn't. It wasn't, you know, what I always wanted to do. I came to it through my own journey and my own struggles with my relationship with food and eating, and my own search for, you know, how to get a handle on things. And I always say I sort of came into becoming a counselor through kind of in the back door, because I came in through attending 12-step meetings and you know, building my own support community and seeing a therapist myself, and learning from all of them. And it became a way for me to I always liked helping other people and got great satisfaction from it. And so it was a way of combining helping other people and helping myself at the same time, you know, that it helped to keep me, keep everything fresh and green for me, and on top of things. So that's how I didn't come into this career until I was in my mid 40s. And I won't say how old I am now. But.
You don't have to. And Vince, we have Vince on mute, so you're safe. So are there other types of eating disorders?
Yeah, so so binge eating disorder has been recognized a few years back, and binge eating disorder is basically it's bulimia, but without the compensatory behaviors. So it's the periods of binge eating, which is defined as eating a larger amount of food than the average person would eat within a certain amount of time, accompanied by a feeling of powerlessness, a feeling of being out of control and unable to stop, even though you may be feeling full or overly full. So person usually goes to the point where they feel sick, but they do not engage in the compensatory behaviors of purging or over exercise or any of those things. So those people tend to, it's not set in stone, but those people tend to be overweight, and so then they have that struggle with having this binge eating disorder, while at the same time desperately wanting to lose weight, and that's accompanied by a lot of shame. There's a lot of guilt and shame associated with binge eating disorder, and it's difficult for people to talk about and to be honest about and get help about it, and so there's also, like, within that whole realm, there's people talk about compulsive overeating, people talk about food addiction. So so compulsive overeating is basically similar to binge eating disorder, except that it's more kind of moderated throughout the day. It's not these periods of intense, stuffing food, and but it might just be more like grazing or kind of eating all day long and just having, poor food choices and eating a lot of foods that are calorie dense. So so there's that, and then there's a whole issue of food addiction, and so food addiction then is kind of controversial, really, depending on who you talk to. There's people in the psychological community that don't believe that you can be addicted to food, and I've seen over the years with conferences that I've gone to, like 20 years ago, when you would go to a conference on eating disorders, nobody talked about food addiction. But then over the years, I'd say my experience is like the last 10 years, you'd see maybe they'd have one workshop on food addiction. And then the next time, a couple years later, there'd be maybe 2 workshops. So it's certainly being researched more. It's being studied more. But I will tell you that there are people who struggle that will come in and say, I am addicted to sugar. I am addicted to flour. Like, they have that internal sense that is an addiction for them. And they see that the same way that they would see an addiction to alcohol or, any kind of a drug. And so I tailor my treatment with clients to what they're basically telling me they have found to be helpful for them, or if they're willing to try it. So there's Overeaters Anonymous, there's Food Addicts Anonymous. There are those kinds of support groups, and the wonderful thing about them is that it's really hard to find support groups for people that are struggling with eating disorders. So they get a lot of support. So people that believe in the food addiction model believe that there are certain foods that are triggers for them, and if they eat them, that they will continue to overeat and they'll lose control and can't stop eating them. So then they would eliminate those foods from their food plan. And they gain support by following the 12 steps, by having a sponsor, and by attending meetings. There are those in the community, you know, of eating disorder professionals who believe that if you restrict yourself from eating a certain food, like tell yourself you can't eat any sugar, that you're setting yourself up to have a binge on that food. That if you keep telling yourself no, 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 eventually you're going to lose control and you're going to, you know, go over the edge and have that food. So they do not promote that approach. That they promote the approach of you have to learn to eat everything, excuse me, in moderation. And now, you know, I'm in this field, I work with people, and I see people who have success with the food addiction model, and I see people that have success with the model of learning to eat moderately. And it's really not so much about that as eating moderately as it is about discovering what it is that is what's happening with you internally, and what are the things that are driving you to think about, I really need some cookies right now. Well, you know, what happened right before you had that thought? Did you have an argument with someone? Did someone say something that hurt your feelings? You know, to get back to the original cause of that and figure that out, and figure out other ways to take care of yourself, which whatever approach you use as a therapist, you end up helping the person figure out ways to deal with their emotions and their unsettling thoughts that are not harmful to them. So you end up in the same place. It's just a different way of getting there, if that makes sense.
It doesn't. You know, I remember reading something about people don't take eating disorders seriously because they believe it's just a matter of self-discipline.
Yeah. No. And when I hear that, I know that that's coming from a person who's never experienced, you know, any kind of disordered eating, and it's just not. It's not something that they can wrap their heads around. That, you know, just stop. You know, they'll say,
right.
You know, well, they'll say to somebody who's anorexic, just eat the cupcake. What's the matter? Why can't you just eat it? You know, so, you know, no, it's not. It's so complex because eating disorders are the result of never just one thing. So there's our genetics. You know, we're dealt a certain hand just by our genetics. Some people have various types of eating disorders in their family history. So there's genetics, there's environment, you know, there's our the socioeconomic group that we come from. You know, there's a culture. There's so many different things. And then there's, you know, one of the big areas that has been shown to be causal is trauma. Trauma has had a major impact on a lot of people in terms of causing or creating eating disorders. And if you think about what I said before about the issue of control, so someone who has experienced any form of trauma, that's an area in their life where they've had no control. They have lost control. It's been usurped by someone else or some situation. So an eating disorder then becomes a way to gain some sense of control over their bodies. I mean, that's what's intended. It doesn't work out that way, but so it's very complicated. And that's why I think it's one of the more challenging diagnoses to treat. And as I said, particularly anorexia. Anorexia has a pretty strong correlation with previous trauma. So, you know, it's just often a really lifelong struggle for those people.
And usually diagnosed in their teens, or is that a fallacy also?
No, it's not. I mean, I think I read that diagnosis is usually like somewhere between, say, 12 and mid-20s, 25. Certainly the younger that is diagnosed, you can look towards a more favorable outcome. So, our kids have been growing up in the world of, social media, and they're under constant bombardment about, we're in the age of selfies. Everybody's taking their picture. We're in the world of, it's all about how you look and, the clothes you're wearing and, how, really how thin you are and how you fit into a certain mold. And so it's very, we're seeing disordered eating and body image distortion in kids like 5 and 6 that are talking about, they went to gymnastics class where they wear those little, those little leotard things, and they'll say, Mommy, how come my belly pooches out and the other girls don't pooch out? So they get into this, this competition. They start to notice these things. And someone I know just told me that her, I think she's 7-year-old daughter came home and told her she wanted a salad for dinner. And she said, why do you want a salad? And she said, because my tummy's sticking out and my friend's tummy doesn't stick out. So it's really challenging. It starts really young, and then, so then it's really incumbent on the parents to deal with that. So that kind of brings up, for me, one of the big topics is educating parents and teaching them how to talk to their kids, and not only how to talk to their kids, but how to talk to each other, how to talk to themselves. If a 5-year-old little girl sees mommy standing in front of the mirror saying, oh my God, look at my stomach, or look at my hips, or look at my thighs, they're taking all that in. And they're also hearing maybe daddy make a comment about the way somebody looks on television, about, look at how fat she is, or something. So we really have to monitor when we have children, the way we speak about our own bodies and about anyone else's body. And I remember going to a conference years ago, an eating disorder conference, and the presenter asked the question, when is it okay to comment on another person's body? And everybody's throwing out all these things, and he said, never. We're never commenting on someone else's body. There's a boundary there. And so, but that doesn't happen in this culture. So there's a lot of work for parents to do in educating, their kids and keeping them safe. And I literally have clients who we try to detox from social media. I'm talking about, I could think of a couple of young women in their like mid-30s who just are realizing that one of them, someone I know, had a baby, and she said, Instagram is killing me. I have to take myself off of Instagram because all these people are posting that, oh, I had a baby a month ago and I'm back in my skinny jeans. And, so we get hit with all of those kinds of things. And I just want to say, because I'm talking about women, but over the last 20 years or so, definitely is an increase in men with eating disorders. And there's more emphasis now on men having certain types of bodies. And, you see more magazines out there that are geared towards men. So they're experiencing similar things, not as much yet as women in terms of developing an eating disorder, but the eating disorders in men are definitely on the rise for the same kinds of reasons. So I wanted to say something about teenagers as we were talking about adolescents. So if you have a teenager in the house, and just wanted to say some things to look out for. So, you want to look for just any kind of changes in behavior, but you want to look towards them changing the way they're eating. A lot of times people will just start to be really like pushing food around the plate, cutting it up into little pieces and kind of pushing it around and hoping their parents are not noticing that they're really hardly eating anything. Sometimes they'll, and this could be in a teenager or an adult, will take a break during the meal and excuse themselves and say they have to go to the bathroom. If that starts happening on a regular basis, they may be purging in the bathroom. So you have to look out for, those kinds of things. Also, they might start to get especially sensitive to cold temperatures. They might be losing body fat.
Wow.
If it's happening over time, gradually, you might not notice, you might not be noticing, but then that will make you, call attention to yourself to, oh, wait, is this kid losing weight? So for teenagers, the best thing that you could do is not be judgmental, but just try to talk to them and just ask, and never about how they look or their weight, but just to talk to them about, how they're feeling, what's going on at school. Try to get them to open up a little bit and then tell them, like, I've noticed this and that worries me, and see if you could open up a dialogue, and, possibly get them to a medical doctor, and then maybe, willing to talk to a therapist. But unfortunately, you have to have your eyes and ears out for those kinds of things when you're dealing with teens. And the typical thing too is once they go to college, a lot of times eating disorders pop up the first semester that they're away at school, and they might come back from school, and they might be, they talk about the freshman 15. Well, they could be 15 pounds less than when they left, or they could be 15 pounds more than when they left. So, and then again, that's an opportunity for a conversation. Let's talk about this. And this is what I'm noticing. You try not to point fingers and say, it's the I statements. I'm noticing this and I feel concerned, and try to open up a conversation about that.
How do you stop, when you talk about families or even friends that are noticing stuff, how do you stop I'm thinking of the teenage body shaming,
Yeah. Yeah.
It's a whole different form of bullying, right?
Yes. Yeah, it is. And I mean, it's a big question. How do you stop it? It's really something cultural now, it's that it has become part of our culture, but there is there is a big movement for what they call body positivity and body acceptance, to try to eliminate body shaming, fat shaming, weight stigma. And there's an organization called Health at Every Size, HAES. And they're promoting a healthy lifestyle that does not focus on body shaming or weight stigma. And I think it involves a lot of, education for school systems, for guidance counselors, for that to be recognized as a form of bullying and not to be tolerated. I was doing some research and about the diet industry, because the dieting industry is as of 2018, it was a $71 billion industry, and it's been increasing over the years, and they're noticing a slight decline, and they think it's going to continue to come down a bit because of the body positivity movement, that more people are getting educated. I tell my clients to go whatever social media they're on, Facebook, Twitter, Instagram, to go and search, put in the words body positive or body positivity. And then they come up with different sites that are promoting. There's no bad body talk allowed. It's all positive and affirming. And it's healthy. It's, people sometimes get confused with it or upset, and they're saying, well, you know, are you promoting obesity? No, it's not promoting obesity. It's promoting health. And a way to get to health is by not shaming people and making them feel guilty and horrible about themselves, because that only tears them down more and doesn't help them to get to where they need to be. So, I mean, it's a huge issue. It really is. And, but I do think there, you know, there are the glimmers of hope and that things are starting to change. But, you know, in the meantime, our own kids, grandkids are still going to be subject to those kinds of things, and we have to be aware of that. But like I say, the best way to do that is to be aware of what how you're feeling about your own body, and what you're saying about your own body. You know, how many times do you look in the mirror? You know, one of the things that is another telltale sign with teenagers is what we call body checking. That every time they walk past the mirror, they have to stop and look and make sure, you know, oh, you know, is my stomach sticking out? How do I look? You know, how many times are we doing that? I mean, we all want to look in the mirror probably before we go to work in the morning, comb our hair, or, you know, that sort of thing. But some people just get stuck there. They literally, they can't get away from it because it has such a hold on it. I've had clients be late for therapy appointments and would come in and be honest and tell me, I couldn't get away from the mirror. I couldn't stop checking. So, you know, so it's challenges in ways that we don't even think about, you know, that we're just, if you're not experiencing it yourself, it's really, it's a whole, they have a different experience of being in their bodies than people with a normal body image do. So literally, when they look in the mirror, they don't see what, if you're looking at this person and they're looking in the mirror, they don't see what you see when you look at them. You know, they're seeing some distorted version of that.
So Zoom can't be helping much these days, right? In the middle of a pandemic, when we're communicating via Zoom and social media, and
yeah,
are you seeing an increase, or are you concerned about that increase?
So I just in my own particular clients, I'll have them sometimes when they get on a Zoom call, they'll make a comment, you know, about how they look, or, you know, or how, you know, I'm so up close. I'm so, you know, they'll have comments about that. But that's an opportunity in the session to talk about it, you know, and to, you know, to try to process that. And because they basically, you know, deal with it every day. I think we've all had that reaction when we've gotten on Zoom for the first time. It's like, oh my gosh, you know, but, you know, some of us are, you know, able to, okay, all right, I can deal with this, you know, but it's much harder because and there's something else called body dysmorphia, which could have nothing to do with really eating disorders, but a person might focus on a particular portion of their body, their nose or their hairline or something like that, which to them is all they see when they look in the mirror, and it's very real. But it curtails the way they are involved in their lives, and that's one of the major criteria for any of the eating disorders: anorexia, bulimia, binge eating disorder, anything. How is it affecting your life? Is it affecting your ability to form relationships with people? Is it affecting your work, your performance at work? Is it affecting your social life, just to be able to go out? I mean, we're all restricted in some ways now with COVID, but some people, you know, don't want to go out with friends. They, you know, they'll say, I don't like the way I look. I'm not going out. Sometimes, you know, we'll talk about them going out with friends for a month before it happens to try to work on all of the different issues that come up with being seen in public, or even just being seen by people that care about them. So that the severity of the eating disorder, the indicators for that is how much a person's life is being disrupted you know, by their eating or not eating, or, you know, some people say, well, you know, I can't go there because I don't have any clothes that fit me, or, you know, how does it affect their work? Or the person who was coming late to sessions because she couldn't stop checking in the mirror. Well, you know, if you have a job, then you're going to be late for your job and you might end up getting fired. So there's a lot of ways that it impacts function. And that's how you know that, okay. And that's when a lot of people decide, I really need to go talk to somebody now because this is interfering with my life, you know.
You mentioned that it's important to have sort of, you know, 4 different players on the team to help someone recover. Are there treatment centers built around that?
So, so usually, so if someone is very severe with anorexia or bulimia, there are inpatient treatment centers, which a lot of times they are, they might be a unit in either a medical hospital or a behavioral health hospital. So if someone needs, they might need, if they're anorexic, they might need a nasal gastric tube where they're fed through their nose if they're so depleted that they really just cannot eat and their body is not ready. Their GI system is not ready for them to be on solid food. So they might have to be admitted so they could get these feedings, and they might also, you know, have an IV in. And hopefully that's usually short-lived, but it all depends. So they might start out at an inpatient facility. Then there are residential treatment centers like Renfrew, which is one of the big in the country, well, actually international. But Renfrew has a residential treatment center outside of Philadelphia, but they have some outpatient facilities in New Jersey. So then they would go there, and it's not a medical facility, but they live there. They're fed there. They're given their meals, and it's therapy all day. There's all different types of therapy groups and individual therapy. And then they might step down to going home and going to treatment for the day. And eventually the layers of care come down to them going, if they had an individual therapist, or finding an individual therapist where they're going to therapy 1 or 2 times a week, and then, you know, hopefully able to, you know, go down from that. But it's important that they're followed by a medical doctor because they, you know, they need to have their weight checked, and we usually recommend that that's not done at home. You know, it's really best not to have anybody in the household responsible for that, but just have a medical doctor doing that. It takes the pressure off the family. So, and a nutritionist, to work closely with a nutritionist. And then for those people that are on medications, you know, they're followed by a psychiatrist. And usually they are on some sort of medication, not necessarily for the eating disorder, but it's usually for depression or anxiety or a mood, you know, disorder that they need to be on to stabilize them to be able to do the work that they need to do. You know, for the eating disorder. So it's a lot. It's complex.
It's complicated.
Yeah. And for somebody that's a family member, it's, you know, it can be difficult. But they need support too.
And on the other side, when you were sort of talking about those that are, I guess they were binge eating disorders, and those who are overweight or consider themselves overweight, things like you're talking about diet products. What about the groups that are out there, Weight Watchers? I can't even think of half of them. Are they working on the positive image, or?
Yeah. I mean, I think, you know, Weight Watchers has shifted over the years to talking about the more emotional aspects of things, and pointing out the reasons, or helping people try to figure out why they're eating or overeating. I think for a lot of therapists that work with eating disorders now, diet is really a bad word. And anybody that's making money from selling diet products is, it's not generally looked upon. I do have as favorable, but I do have people that find, like Weight Watchers, they say that it's a plan that they can follow, because for a lot of them, they've been doing it for a number of years, which again goes back to that, the dieting industry is a $71 billion industry, but most people, 95% of people regain the weight in 1 to 5 years. That's the data, so so it makes you wonder, what are we doing? But some people do tell me that Weight Watchers is comfortable for them, and that they like that idea of going and getting weighed, and I try to talk to them about what all that means and help them not to be overly invested in the number on the scale. I mean, most of us would prefer that nobody has a scale. There's a cartoon, I couldn't find it for today. It's a cartoon I have from a number of years ago, and it's two little girls. They're standing and they're looking at a scale, and the little girls look like they're about 6 years old or something. And the one little girl says to the other, "What is that?" And the other little girl says, "I don't know, but it makes big people cry."
Oh.
So, I mean, I have people that hide their scales in the basement, so they're not getting on the scale in the middle of the night. And, so and so what happens with that is, so even if people tell me they're going to get weighed once every other week or once a month or something, but then what happens is the number on the scale tells them whether they're a good person or a bad person, basically. And then they come in and, then we have to deal with that and what that means. And even though they might have done everything possible and eaten really well the whole month, so my preference is that, there aren't scales involved, except the exception is for people with anorexia, where weight loss is life-threatening. So that has to happen. Other people will go into a doctor's office for a checkup, and they'll tell them, they don't want to know their weight, and they'll do what we call a blind weight. And they do that in treatment centers too. They're not telling people in a treatment center the number on the scale. They're using it for their information that they need for their medical needs, but they're not telling the patient or the client that. So then when patients get discharged, they learn to go, when they go to the doctor, they tell them they don't want to know the number, and they turn their back. They actually get on the scale backwards and turn their back, so they don't have to know the number. So, I mean, they will know if they're losing a lot of weight or gaining a lot of weight by the way their clothes fit. So, but the number does a number on them mentally. So we try to avoid that.
Is there anything, I'm sure there's hundreds of things that we missed, but that we didn't cover?
Let me see. Well, I just wanted to mention that for people that watch this that might be thinking, like, do I have an eating disorder, that might be struggling? So the organization, so this is National Eating Disorder Awareness Week this week. And that organization, the National Eating Disorder Association, NEDA, N-E-D-A, they have a wonderful website. And on their website, they have a screening tool that you can go in and you can answer questions, and they will send you, based on your answers, they'll send you an assessment of whether they think that, that you have an eating disorder, or where you are in that, and what might be helpful, and they'll give you some suggestions. So that's a good website to check out. There's also another website, is it's Eating Disorder Catalog. It's ED CATALOGUE.com, edcatalog.com. They have articles, they have books, they have all kinds of, I think they even have like videos, all kinds of information about all the eating disorders, for families, for, for the person who's suffering, for friends. How do I talk to somebody that I think might have an eating disorder? How do I talk to my kids? So there, and Renfrew.org Renfrew is the other, the big hospital or residential treatment center. They have tons of information on their website, Renfrew.org. But that just reminded me, I wanted to say something about, if we have time.
Sure.
Okay, about about parents that have children that they are concerned that they are gaining weight. And because parents are never sure, how do they talk to their kids? They put their kids on a diet. What do they do? So the general recommendation is that you just work as a family and you do family activities around health, and that the conversation is always about health. It's never about weight or size. And that you're talking about healthy eating, get the kids involved in, planning meals and cooking meals. And as a family, that you're exercising. And, you don't even have to call it exercise. Hey, after dinner, we're going to go out and ride our bikes, or we're going to go play kickball. But you're trying to, if your household has been maybe a little bit too much into their kids, into the TV or into their screen time, and trying to gradually move them away from that, which is much better for them in so many other ways, into just, this is what we do as a family, but not talking about diets or, them weighing too much or, that kind of thing. But just, this is normal behavior for this family now. These are and it doesn't, you're not telling them they can't have, cookies or ice cream or anything like that, but that, moderation, and working around that. So again, a big, a lot of it's up to the parents, and finding their own, what they might be dealing with themselves. They might have to change some of their own habits. Maybe they need to get up off the couch, because a lot of times, it might be a sedentary family. So, but that's the approach that's recommended, just around healthy eating and exercise.
And then at Starting Point, we have a couple eating disorder meetings, don't we?
Yes, we have Eating Disorders Anonymous, and we have the Anorexia and Bulimia Anonymous. EDA is, I think that one's on Monday.
Yes, I'm gonna let Vince speak up here.
Yeah, I was going to say Vince has to chime in on that one. Yeah, we have the two meetings that.
You have to unmute, Vince.
Yeah.
EDA meets on Monday night and Friday afternoon. We just added a second meeting, EDA. The Monday nights at 6 and Friday afternoons at 12:30. And ABA meets on Wednesday nights.
Oh, okay.
Okay. Now the OA group was meeting on Tuesday, but they haven't said whether they're coming back yet or not, because they didn't do Zoom. These other three meetings are on Zoom.
Okay.
The numbers are on the website. I do want to mention one thing, and we did this last night. We did a lot of readings on the ABA group, a lot of readings on the family and the effect on the family. And they have a fantastic chapter in their book on stories of family members and how family members could really get involved in helping people with anorexia, bulimia, and different types of things.
Yeah.
I was really surprised to see, how many stories were in there.
Yeah.
Of actual family members telling their stories. It's pretty neat.
Oh, that's great.
Yeah.
Yeah,
And
because,
they
yeah.
do the same thing in the EDA book too. It's pretty neat. I like when families have enough strength to tell a story,
Yeah.
to learn about detachment.
Mhm.
You know, we don't have them in this area, but there's also Abanon groups, okay, and also Oanon groups for family members.
Okay.
Unfortunately, we don't have those meetings in this area, but they're big in New York, California, the Midwest. It's just interesting. We got to get more of this stuff to the East Coast.
Yeah.
Yeah.
Right.
Well, it has to start out west, right?
Crazy.
Well, Anne, I can't thank you enough, and I thank all of you who've joined us today. You can find Anne's profile on this Starting Point's website, which is just startingpoint.org. You can also find our YouTube channel, and you can find Vince DiPasquale's lectures all on our website, and we have links that will lead you anywhere you'd like to go. And thank you so much for taking the time today. I understand it a lot better. I hope everyone else does as well.
Thanks, Ellen.
You're very
All right.
welcome.